foundation. Does that make sense to everybody? So we're just doing the assessment. So we're just gonna say he's a victim of a fall. Okay. So my proctor just said you just called for a fall on the basketball court. I don't know. Whatever. I don't really care. Whatever story you want to make up. So it's a fall. Okay. So I am going to put on my personal protective equipment. And as I enter the scene, I'm making sure that the scene is safe, that there aren't any hazards that I'm going to injure myself on, nothing that I'm going to trip over, nothing that's going to hurt me. And I'm going to confirm that I am here for a fall. That's what I was responded for. And I'm confirming that I have one patient, considering C-spine because it is a fall. So I'm going to think about that as I approach the patient. And at this point, I don't see anything that leads me to believe that I need any additional resources at this time. But I think I will direct my partner as we approach the patient to marry the head and hold that in place while I first begin to talk to him. So my partner goes up there, marries the head. I'm going to approach my patient. I'm going to say, "Hi, sir. My name's Lori. What's your name? Don't move your head. My partner's holding your head." Okay. All right, Nick. Nick's airway is open. He was able to talk to me. He was kind of grunting a little bit, but he doesn't appear to be in respiratory distress. If I had pulse oximetry, I would instruct another team member to put that in place and assess that need for oxygen at this time if he's less than 94%. If we don't have pulse oximetry, I think I would hold off on oxygen right now because he doesn't appear to be in too much respiratory distress. I am feeling his pulse. It's present at the radius, strong and regular. His skin is warm, dry, and pink, and I don't notice any obvious bleeding anywhere on him. All right, Nick. Nick, do you know what day it is today?
It's Wednesday.
Wednesday. Okay, and where are you right now?
I'm at my house.
At your house?
Yeah.
Okay, what happened?
I fell out of the back of my truck.
Oh, okay. So, and you were up in the bed of the truck?
Yeah, I was actually on the roof.
You're on the roof. Does it have a camper shell?
Yeah.
Oh, okay. So you were all the way up on the camper shell.
Yeah.
And you fell off of that. Did you just lose your balance and fall, or did you get dizzy and fall?
I got pushed.
Oh, you got pushed off. Okay. Do you remember what part of you hit the ground?
I think it's my head or something.
Your head?
Yeah.
Okay. So you remember falling and hitting your head?
Yeah.
Okay.
It hurts.
It hurts. Okay. Do you hurt anyplace else?
No, actually, I don't hurt at all besides my head.
Okay. And were you able to get up afterwards, or is this where you
No, I can't get up.
You can't get up. Okay. Because it hurts, or you're not physically able to get up?
I can't physically get up.
Oh, okay. All right. Well, I'm going to check all over you and see if there's anything else going on. Is that okay?
Yeah.
Okay. So I'm going to check
Ow.
his head. Where's it hurt? Right here in front?
On the back.
On the back here?
Yeah.
I'm going to look at
On
my
the top.
gloves and see if I see any blood, because I'm looking for DCAP BTLS, which is deformities, contusions, abrasions, penetrations, burns, tenderness, lacerations, or swelling. So I don't feel any deformity in your head, and there's no blood on my gloves. I'm going to check inside his ears. Okay, can you close your eyes for me and open them? So I'm checking his pupils. Does any of this hurt right here?
Nope.
Not on your face?
No.
Okay, can you open your mouth for me? Okay, nothing's dislodged. Any of this hurt on your chin?
No.
Okay. How about on your shoulders right here? Is any of that hurt?
No, not
How about
really.
the back of your
Ow!
neck? Ah, that hurts right
Yeah.
there?
Oh my gosh.
Right on the center of your neck?
Yeah.
Okay. All right, so make sure you hold nice and still for my partner there. He's holding your neck, okay?
Okay.
All right. Can you take a deep breath for me? Does that hurt?
No.
Okay, I'm checking to see if his chest is stable, if it rises equally. Take a deep breath. Does that feel okay? That doesn't hurt you at all?
No.
Okay, I'm checking again to see if there's any instability. I could cut his shirt off and visualize that as well. Take a moment to listen to lung sounds. Take a deep breath for me. Again. Again. One more time. Okay. None of that hurt in your chest?
No.
Okay, just your neck is hurting.
Really bad.
And the back of your head really bad. Okay, we're gonna get right to helping you with that, okay?
All right.
Any of that hurt?
No.
Here?
No.
How about here?
Nope.
Any here?
No.
So I'm looking for any tenderness, any feeling of rigidity. I would check and see if I see any bruising in that area. None of that hurts like that.
No.
Okay. I'm gonna check your pelvis. I'm gonna squeeze and push down, not rocking the pelvis. Does any of that hurt?
Are you touching me?
I am. Can you not feel that?
No.
Can you feel this up here?
Yeah.
Can you feel this right here?
Yeah.
Can you feel this right here?
Yeah.
Okay. But this you don't feel?
No.
Okay. How about on your legs? Does any of that hurt?
Are you touching me?
Yes, I am.
Oh.
Okay. So I'm going to check for some stability in his legs, and I'm going to look for any injuries. I would cut his pants off. Ew. That's disgusting. He's my son, but I really, seriously. Can you feel me touching your feet? Ew! Can you feel me touching your feet?
No.
Okay, so you can't push down?
No.
Okay, and you can't pull back up?
No.
All right, let me check and see for pulses. His pulse is present. Let's cover those back up. Just for, you know. Okay. Can you feel me touch your arms?
Yeah.
You can feel that. Okay. Can you squeeze my fingers, both of them at the same time? Okay. Can you wiggle your fingers?
Yeah.
Can you feel me touching you?
Yeah.
Check your pulse. Okay. So you can feel everything up until right here?
Yeah.
Okay. Does your back hurt?
Yeah, kinda.
Okay. So you said your neck hurt.
Yeah.
Does the down your back further hurt?
Yeah, it really does.
It really does.
Yeah.
Okay. All right. So what we're going to do, Nicholas, is I'm going to put this arm right here. And we're going to get a couple other people. And we're going to roll you up onto your side, roll you back into the backboard. I'm going to check your back while we do that.
Okay.
Okay, so this is part of the C-spine skill. And I don't have enough people to do that. So what we would do, though, in this situation is we'd pull him up as one unit all together, pull him toward us, and then we would check his back. So does this, yeah. We're not doing the C-spine skill, so I'm just finishing my assessment part. Okay, and I'm going to feel any of this. Does any of that hurt?
No, not right there.
Which part right there hurts?
Yeah.
Okay, and I don't feel any deformity. I don't want to poke around too much. I don't see any bruising. So you can't feel me touching back here?
No.
Okay, so right here is where it hurts?
Yeah.
Okay, so we're, as a unit, going to roll you back. Okay. All right, Nicholas's Glasgow Coma score is 15. Because he was able to answer all the questions appropriately. He remembers what happens to him. He's got some posterior head pain, neck pain, and lower back pain, potentially some neurodeficit. He's a critical patient at this point, so I didn't need additional resources in the beginning, but I would ask for those now. We get a full set of vital signs, get him in C-spine precautions. If ALS can arrive before we leave, that would be great. If not, perhaps we'll rendezvous and take him to a trauma facility, and I would manage his injuries by my C-spine precautions, which is the next thing you're going to learn. Okay, so we're learning one thing at a time. So that's how I would manage his injuries, continue to monitor his vital signs and his pulse oximetry if I'm using that, and we're done.
Yeah.
So I didn't hear a transport decision. Was that?
Oh, you're right.